Hey guys, my name is Boris. I'm a physician assistant, and today for a pre-PA Q&A, I'm going to answer this question from a Facebook group called Low GPA Pre-PA Support Group, which is a great name because those of us who want to get into PA school who happen to have a low college GPA, you really do need a lot of support. It's a very tough uphill battle that sometimes does yield wonderful results. Like for instance, for me, I had a crappy GPA in college, no experience, you know the whole story. If you've been watching this channel, if not, then if you haven't, check out this video right here. It'll tell you the whole story. But I just want to say that it is possible. I know it's totally daunting. I know it's like a super competitive grad school. It's like the most desirable career, especially health career, that there is. It keeps ranking so highly. It's a wonderful job. It's it pays very well. It's a great lifestyle, or can be a great lifestyle. So sure enough, lots and lots of people want to get into PA school, making it super competitive. So if you're not a super competitive student, like I said, it's kind of daunting. That being the case, people do it all the time. People with low GPAs get into PA school all the time. And if you check out this Facebook group, Low GPA Pre-PA Support Group, I freaking love the name of this group. It's a support group, which is fantastic. But it's not just a support group. There's all kinds of people giving advice, people like me who have been there, done that, and went to PA school and now are on the other side actually practicing PAs. People who are also applying, sharing tips, asking questions, getting questions answered. It's just a good resource. But either way, so the question is, hi, how many hours do y'all recommend having for a PA application to be competitive? This answer is going to be very nuanced because every school is tremendously different. So I know it's a little bit cliche to say it depends, but it depends. So a lot of schools, the reason it depends is a lot of schools focus primarily on experience. So they really want you to have a lot of hours of healthcare experience. Some schools focus much more highly on GPA. So they would let it go kind of more if you have not so many patient care experience hours, but if your GPA is solid, you're a very solid student. And the reason for this is because different programs are structured in different ways. Some really just need you to be to learn really quick, to pick up really, really quickly, and then they'll teach you the practical skills on the back end. Some schools, maybe those who have slightly longer programs, they're a little bit at least less concerned about your academic abilities. Don't get me wrong, every PA school needs you to be a very, very top tier student. You need to be able to learn large amounts of information very, very quickly. But some schools are just a little bit less, into that, less prioritizing the academic abilities and more prioritizing the experience that you bring to the table and vice versa. So for instance, my college, Lemoyne College, it was a 24-month program. It's quite accelerated as far as PA programs go, which means the didactic portion is done in 12 months, which is, as far as PA schools go, it's as fast as it gets. No school is faster than that. It's very, very quick, very, very condensed, which means all the knowledge that they have to teach you in order to pass your pants is condensed into that 12-month period, which means they have to have very, very academically capable applicants going into this program. So my school, for instance, favors GPA way above patient care experience. So I think the minimum to apply, at least when I was applying, was 750 hours, which is pretty low. I don't know if they've raised it to 1,000, I can't remember, but either way, it's on the lower end of what PA schools want. And I think I only had 500 when I submitted my application, and that rose to, just above 1,000 by the time I matriculated, maybe 12 or 1,300. But when I submitted my application, I think it was 500-ish, maybe close to 700, but not much, very, very low. Some of the answers that this person got is the first one right here. I've heard at least 2,000. I have a ton, 14,000 plus, and it doesn't seem to be helping much. Okay, kind of a subjective example, but this person said that they've heard 2,000. I've kind of heard that too, rule of thumb, you want 2,000 hours of patient care experience. What that means is on average, if you're applying to lots of different schools, you probably want that. But if you happen to be applying to programs that, like the one I went to, that do not require a lot of hours, they're serious about that. They know the kind of applicant that they want, the kind of student that does well in their program, and if that happens to be someone with less experience but better grades, better academic ability, they don't care as much that you have 2,000 hours. Like I said, I got in with less than 1,000, and a lot of people got in with less than 1,000, and now we're all, wearing the stethoscope, wearing the white coat, practicing PAs, NCCPA certificate on the wall, It's legit. So you don't have to have 2,000. You don't have to have 10,000. You don't have to have 5,000. In my case, I didn't even have to have 8,000 when I submitted my application. So like I said, very case-by-case basis. Do research on every program that you realistically think you can get into, every program that you are interested in, see what they need. And don't be discouraged if you don't have a whole lot of hours. If you happen to have 500, 1,000, 700, whatever, there's programs in the country that you can very well get into if you have other characteristics that these programs are looking for, okay? So just want to let you know that. Answer this question here. How many hours do you recommend for having a P application? The easy answer is it depends. The hard answer is what I just told you in the last, 5, 6, 10 minutes, however long I've been flapping my gums about this topic. So anyway, hopefully that helps this person. Hopefully that helps some of y'all out there. And stay tuned for the next pre-PA Q&A. Good luck for everybody applying to PA school this year.